I look at some of the challenges with staffing and mandating ratios. From a clinical perspective, no two patients are the same. Oftentimes, I'll give an example of a patient with a condition called diabetic ketoacidosis in the ICU that may have a 1-to-2 ratio, so one nurse for two patients. But that patient doesn't require a whole lot of work from the nurse. We have that patient on a insulin drip. We're watching their levels. It's very, very little actual work that a nurse is having to do. On the other hand, you could have a patient on a medical surgical unit with an eye injury that requires eye drops every hour, but those eye drops are in the refrigerator because they have to be kept cold. And so every time the nurse has to go in and give that eye drop to that patient, that could take 20 minutes out of every hour that that nurse is spending time with that patient. So I look at the complexity of the patient population a little bit differently in terms of not necessarily the acuity, because that patient in the ICU has a higher acuity, the reimbursement is higher for them, but more so from a workload. How much is that nurse's work going to be taken in? That medical surgical nurse may have 4 or 5 other patients that now, out of 20 minutes that they just used on this one patient, they've got 40 minutes for the other patients. So when I look at some of the challenges, that's just one example. There's so many different challenges, including education. You could have a very seasoned staff on a shift that requires less nursing than you have on a different shift with a very novice staff that requires a bit more nursing support. You could have technology changes that are coming into systems that require us to look at supporting more nurses than we had historically on a specific unit or on a specific shift. You could have advances in medicine and technology. I mean, there are multiple different factors that need to go into what determines the appropriate staffing ratio. So when I look at the complexity around staffing and productivity, it's those type of questions that need to be asked to determine what is the right nurse to patient ratio, and how are we able to make adjustments to that based on all of the other compounding factors that play into that patient's care.